I'm going to make this also very Asian focused because the diseases are actually different in an Asian community compared to what you read, for example, Katie is not Asian. Okay. The other thing that I should mention to you that I have too many slides. I know that now, so I'm going to skip through Hep A. Hep A is really not the issue. It really is Hepatitis C and Hepatitis B. And for the Asian community, it's actually much more Hepatitis B than Hepatitis C. The other important thing I need that whenever you invite a speaker is make sure they tell you this. What are their influences and disclosures? And very, I'm probably the only one that has no pharmaceutical disclosures. So I have no. So what I hear, what you get from me is what I get from conferences as opposed to what they're trying to tell me. So I'm going to talk to you about why viral hepatitis is important. What is the difference between acute infection versus chronic infection? Learn about the viruses. And I'm not sure how much you want to hear about the testing that can be done, and we'll go into some of the treatments. So, what is acute viral hepatitis? So this is when you've never had it before and you get it for the first time. Okay? So for example, when you read Katie and you hear about hepatitis B and hepatitis C, a lot of it is brand new infection. They've never had it before. Okay? So they have their HIV, then they get brand new infection. In the Asian community, it is likely the opposite. So for example, the Asians are likely to have contracted hepatitis B when they were born in Asia, and then they got their HIV. Okay? And very similarly, the hepatitis C is not most commonly injection drug used in the Asian community. It is likely acquired in Asia and transported here. So immigration in Toronto is the biggest source of infection. In the rest of Canada, it's injection drug use, but in Toronto, it's immigration because there are certain countries with a lot of hepatitis C. Okay? So, but to know that someone has new infection, you really need a time machine. Someone must have tested you before, your test must have been negative, and then now I see a lot of Asians, and they say to me, I was negative, I immigrated to Canada, they checked me, I was okay. The problem with that statement is that when you immigrate to Canada, all they checked you for is TB, syphilis, in the hypothetical case where you got the infection now. Let's say you did use a needle and you got a new infection. The virus is extremely smart, so even if you got stuck here or in your big toe, the virus knows what to infect. It makes its way through your body and very specifically goes into the liver and sets up shop. Now, all viruses want to do is make more copies of itself. And the hepatitis C and hepatitis B viruses are very, very smart. It takes over your liver and says, instead of doing liver stuff, make more copies of B. Okay? Now, here's the interesting thing. It's a different bench from what you just heard because the virus itself actually does not damage the liver. So what happens is your own body realizes that the liver cell has been taken over and it's not good. So your body's immune system will now start to fight the virus. Okay? The problem, of course, is the virus lives in your liver, so while it's fighting the virus, it's also fighting the liver, and that's what causes the damage. You yourself damage the liver. Okay? And when you kill off liver cells by your immune system, that's what we call hepatitis. Hepatitis is Latin, right? Latin or Greek. Hepa is liver, itis means inflammation. Inflammation means your immune system attacking it. So here's sort of a cartoon. Let's say these are weeks. If you got an exposure right here at time 0, and I'll tell you that in the last month, I've seen like 4 or 5 people with new infections with hepatitis C. One got it on vacation in Cuba, got a new tattoo. Another one slipped up and used drugs again. So they got their exposure here, and they have no symptoms whatsoever. If their doctor did not do a blood test, they would not have known. But this line represents how quickly their liver is being damaged. There's a blood test called ALT. It only lives inside the liver. But when your liver cells die, it releases, and you can find it in blood. So the numbers can go very high, and these people usually feel absolutely nothing. Okay, that's the reason why you must get tested to know if you have this hepatitis. Now, the fact that there's hepatitis means that your body is fighting the virus, right? The reason why the liver cells are dying is not because the virus is killing it, it's because your immune system is killing the virus that lives in the liver. And acute hepatitis, there's a good chance if your immune system is any good at all, it will kill all the virus will be gone. So it comes back down to normal. Okay? So acute hepatitis, there's a chance it'll go away, but there's also a chance that after a while of fighting the virus, your immune system will realize it's losing the fight. Okay? It fights the virus, and your virus fights back. It fights back by fooling your immune system and saying, don't fight me. And after a while, your immune system is smart enough to know that if it keeps on this level of severe damage to the liver, it will kill you. So your immune system will say, enough. We're not going to keep on, we're not going to win this war. We're going to come to a truce where we will tolerate the virus, trying to cause as little damage as possible. Okay? So these people will have virus infection for the rest of their lives. Their immune system will always be keeping the virus in check. It will be doing some damage to the liver, but not a lot. Okay? Doesn't sound that bad, and actually isn't. The problem is if you let this go on for 10 years, 20 years, 30 years, then after a while, your liver is punished, right? It can only take so much damage, and your liver cells will start to die, and that's when we have scarring in the liver and something called cirrhosis, okay? Cirrhosis is a point where your liver is so damaged, other bad things can happen, and I'll tell you what some of those bad things are. All right, so remember acute hepatitis, viral infection comes here, your immune system beats up on it, gets rid of the virus, and that's a good thing. So for hepatitis B, believe it or not, 90% of infections, so if there's 100 people infected with hepatitis B, they will do this, and they'll get rid of it, and there's no more hepatitis B. Okay? The only people that you fail to control hepatitis B is if there's something wrong with their immune system. For example, they have HIV. For example, they're a baby born to a mother with hepatitis B, which is the most common source of infection in Asia. The mother has hepatitis B, gives it to the baby. And the reason why is because when the baby is growing in the mother's womb, the virus sends proteins telling the baby that not to attack it when it's infected at birth. The virus is very smart. So as far as the baby is concerned, when it gets infected, it never realizes it's infected. It thinks that the virus is part of its mother. Okay, and that's why if you get a new infection as a baby, if there's 100 babies infected with hepatitis B, 10 will get rid of infection, 90 will go on to lifelong infection. Which is why in Asia, it's just so common in Asia that this happens all the time. Okay, so in China, about 1 out of 5 people have chronic hepatitis B. I'm not surprised by what you said, that your major problem in your community is actually hepatitis B. So to bring that back, if you've ever been to an Asian wedding, usually you sit at a table of 10, and you tell people at these meetings, 1 or 2 of you has hepatitis B. Okay? Now, and this is what happens. With the acute infection, there's initially a lot of damage, and then after a while, your immune system says, I give up. I cannot get rid of the virus. I will tolerate the virus, and there'll be some low-level damage to contain the virus a little bit, but I cannot get rid of it. So that's chronic hepatitis, and that's what we mainly worry about, because chronic hepatitis can cause cirrhosis and its complications. Okay, so I'm not going to talk about testing. So if you have hepatitis, do you feel bad? The answer is no. Okay? Even if there's ongoing damage in your liver, you feel completely normal. What if you have terrible damage and most of your liver is now dead? Let's say half of your liver is now completely scarred up and you have cirrhosis. How do you feel? The answer is normal. You don't know. Unless they do a test and know how to look at it, you don't know. So not that long ago, the only way of telling how much damage there was in your liver was by doing a biopsy. Now, biopsy means to stick a needle from here between your ribs into your liver and taking a little piece out and looking at the microscope to see how much damage there is. We're better than that now. We have now recognized there's a lot of hints that someone has cirrhosis. So the easiest thing, I say this for family doctors, is look at a very common blood test called a CBC, or blood cell count. You know, if your hemoglobin, white count, platelets. If your platelets are under 150, which is what people consider normal, chances are you have cirrhosis. Okay? So it's a different way for doctors to think. Platelets stop you from bleeding when you're cut. Okay? And you only worry about that when the platelets are way under 50, more like 30 or 20. So in the past, doctors didn't care if your platelet count was 130 or 120. But for liver doctors, we say it's not the bleeding risk. This is a sign you actually have cirrhosis. So it's an early recognition sign. So this is one of those tests, if you go to have an annual physical, you always get this test. Okay, and the sad thing is that you can actually see people's numbers going lower and lower with the years. And you can say, well, that's when you became cirrhotic, is when you hit 150. Okay? So how do we know this? People have started cluing in. They've done studies where they went to a general group and looked at everyone's platelet count. And anyone was under 150, they did tests on them. And sure enough, most of them had cirrhosis and never knew it. Never knew they had liver disease. Okay? So turn it around. Where I see people that I know have liver disease, right? They come to me because they have hepatitis C or hepatitis B, and if their platelets are under 150, it's almost a guarantee they have cirrhosis. So that's how useful this particular blood test is. Okay, let's skip that one. This is a very interesting test. It's called a fibro test. You may or may not have heard about it, but in the late 1990s, when hepatitis C was first described, people were not sure it actually did anything bad. They had to prove that it caused liver disease. So what this French guy did in Paris was he biopsied everybody with hepatitis C, and he asked, when do you think you got hepatitis C? When did you first use drugs? When did you have your first blood transfusion? And then what he said is that the longer you had hepatitis C, the more scarring you had in your liver. So therefore, hepatitis C must cause scarring in the liver. So they proved that hepatitis C was bad. But the other thing they realized is, number two, people hate to have a biopsy because it's painful. Number three, whenever you go and do a biopsy, there's a good chance you won't do it properly. Because if you don't do it properly, your size is too small, and when the biopsy is too small, you wasted your time. So they said a biopsy is a bad test. Okay? So what he did, he's a very smart man, who's now a very rich man, is that he went back to all these people with biopsies, and he said, let me do every possible blood test on you that might be associated with liver scarring. And he found 5 blood tests. And when you put them all together with how old the person was, and whether they were a man or a woman, into a complex formula, he could actually tell you how much scarring there is in your liver without a biopsy. Fibro test. Okay, we have this routinely in Ontario now. The reason why he's rich is because he said, do these blood tests, come to my website, give me your credit card, I will charge you 50 euros and I'll give you the answer. He is a multi-millionaire because of this. Okay, why do we have it? It's because his student was writing a research paper and he published the formula in this paper. So we stole the formula, put it on an Excel spreadsheet, and we don't pay him anything. Okay, so, but we do use fibro tests. It's actually a very useful test. Now, his competitors down the street, everything is done in Paris, okay? They loved cheese. And someone wanted to know how done the cheese was, how hard it was, right? Instead of doing a biopsy, they said, can we look at it in terms of hardness? So the cheesemakers invented this machine that knocked on the cheese. This is not as hard as this, right? And of course the French liver doctors also love cheese, and they say, wait, the liver is like cheese. Because if there's scarring in the liver, it gets harder and harder. So if you can tell how hard the liver is, you can know how much scarring there is. Brilliant. So, in between the ribs, this machine just knocks 10 times. Okay, exactly the same way. And it can tell you how hard the liver is underneath the ribs. And with that, within 3 minutes, I can tell you how much damage there is in your liver, whether you have cirrhosis or not. Okay? So we have one of these machines. It's beautiful. It works. Okay, so we can fibro test you, we can fibro scan you. And with these two things, we hardly do any biopsies anymore. We used to do 4 biopsies every day. Now we don't do anything because we don't need to. Okay? So you can actually say how bad things are. So why do we care how bad are things? So I'm going to tell you what the liver does. So I loved it because you said the liver is a filter. The liver is not a filter. The kidney is a filter. So in the kidney test, you hear something about GFR, glomerular filtration rate. That's a measure of kidney function. So what does the liver do? The liver is part of your digestive tract. So when you just ate dinner, the food came down your esophagus or food pipe into your stomach. You broke it down into small little bits, right? Not good enough. You have to come to your small intestine where all sorts of enzymes break it down into microscopic little bits and you can absorb it because you want the energy from food, right? The first place it goes to is your liver. All the veins of your bowels go to your liver. So that tells you that your liver's job is to take raw materials, which is broken down food, and process it. It is your factory. Your factory takes raw materials and builds things with it. You build a car, that's what your liver does. All your proteins, carbohydrates, and fats, small molecules, your liver builds things out of it. Okay? Whenever you build things, you are never perfect. There's always some waste. So your liver is smart enough to say, this is good, I'm going to build it, and then throw it out this vein, and right over here, I don't show it, is the heart. So everything good is sent to the heart, your heart circulates it around. Everything bad is thrown out into the body. So it's not really a filter, it's smarter than a filter. A kidney is a dumb filter, bad things just pass out. This one, your liver makes a decision, good or bad, good to the heart, bad out. And that's what your liver does for you. Okay? So in liver failure, you cannot do that. You cannot make proteins, carbohydrates, and fats. That's why if you ever see someone with liver failure, they look like they're starving. They look like they're concentration camp, barely surviving. All their muscles are gone, they turn yellow and they're swollen. It's because they cannot make proteins, they cannot handle energy. Even if you feed them, it's no good. Okay, and that's liver failure. All right. This is a very medical slide, but this actually tells you very well what are the stages of cirrhosis. When someone has cirrhosis, I told you, that's the stage where you can get complications. And what are those complications? They tend to happen in this way. These are 1-year transition rates, which what it means is if you have cirrhosis and you have no complications, your chance of living the next 1 year is 99%. Not bad. Your chance of living 5 years is 85%. Not bad. Okay? So for an adult, 50 or 60 years old, if I told you that you had a 5-year survival of 85%, that's not any different from someone who has no liver disease at all. Okay, so cirrhosis is, sometimes I tell patients they have cirrhosis, they think they're going to die, they think they have cancer. But it's not true, I just told you, their survival is actually close to someone who has no liver disease at all. Okay, the problem is they can get their first complication, which is esophageal varices. Remember I told you all the blood vessels from your gut goes to your liver? If your liver is scarred, the blood can't flow through the liver properly. It will back up. Okay, and varices are swollen veins where blood is having a tough time flowing through the liver. And in your food pipe or esophagus, these veins lie on the surface, exposed to air. So can you just imagine a balloon? If you blow it up too big, any bigger, it will burst. Okay, that's what varices do. If they get too big, they will burst and bleed. So if you have cirrhosis with no complications, every year you still have liver disease, and an 8% chance you will develop varices. That's how you leave it. So 1-year transition rates. And if you have varices and your liver disease is still there and you haven't treated your Hep B or Hep C yet, there's a 22% chance your varices will burst and bleed. Okay? Stage 4 is the stage of liver failure. So your liver is now it's not just a flow problem, but it cannot make proteins, cannot make fats. And at this stage, you cannot, when your proteins are very low, blood starts leaking out of your blood vessels. Okay, it's almost like it's oozing through the wall, and it accumulates in your abdominal cavity. So these people look like they're pregnant. Their abdomen is just full of water, and that's what we call ascites. That's liver failure, and liver failure is very bad because your 5-year survival is down to 46%. Okay? So up here, when you just have a pressure problem, survival is pretty good. But once you get to a water problem, you literally are dying. And without intervention, your chances of death go very high. And that's the stage when we actually start talking about you need a liver transplant. All right, so these are some graphic pictures after dinner, but this is what I mean by esophageal varices. Just imagine if you look inside, they put a TV camera through your mouth down into your esophagus. And imagine a tube, and see these big columns here? These are all big veins, and this is a vein that has ruptured, a balloon that's ruptured. There's a hole here, and it's just squirting blood. And this squirt is constant. Okay, just imagine if this is constant, it's not painful, it's just a hole there, you don't feel it. But because your stomach fills up with blood very, very quickly, you're gonna feel sick to your stomach. And some people will just throw up, because some people just throw up, but other people never throw up. So if they throw up, it's all blood. There is a leak. If they don't throw up, the blood will go through and get digested. It comes out at the other end, black, sticky, very, very smelly. It looks like road tar. Okay, and you can smell this down the hall of the hospital. So everyone knows that someone is bleeding. So we tell patients, if you have cirrhosis and this happens, you go to the hospital right away, because this is happening inside you. And what the doctors can do is, through the same video camera, they can tie a rubber band around here, and it looks like this, and it will stop the bleeding. And that will save your life. Okay? We also tell people, please, please, please do not drive to the hospital. Because you're bleeding so quickly, you could pass out. No one wants you driving and passing out. Okay, this is liver failure. This is not just a pressure problem, this is ascites. Look how big the stomach is. And you can imagine, and we do this often, you stick a needle in here, the water will just come out. And there could be, in this person, it looks like there's 8 or 9 liters of water in there. Okay, and this is the very end stage of liver disease. This is when you're dying of liver disease. Notice he's got no muscle mass left. He's jaundice. Jaundice is actually the last stage of cirrhosis people are about to die. Okay, so that's why we worry about hepatitis C and hepatitis B, because it can cause all that stuff. I should also mention that once you have cirrhosis, you have a higher chance of cancer, and this is just someone with cancer. That's a cancer on the CT scan. Okay, so those are the complications of cirrhosis. Bleeding from the pressure, liver failure, liver cancer. 3 things that kill people with liver disease. Okay, now, until, believe it or not, this stage, until it bleeds, you feel normal. Okay, it's not until the stage of liver failure that people will feel weak, tired, no stamina. But until then, they feel normal. You have to lose about 80% of your liver to hit this. Okay, so if you've ever seen someone walking down the street with this, you know they're working on 20% of the liver, and that's when they feel sick, and it's way too late. That's why we say get tested. You want to find your liver disease before you get to cirrhosis, and certainly before liver failure. And this liver cancer, believe it or not, this person has no symptoms. Liver cancer does not cause pain until this cancer is this big. Okay, so once again, another reason to get tested, because liver cancers that are this small we can cure, this big we cannot. Okay, I'm not going to tell you about these cases. We just don't have time. And I'm also not going to talk to you about hepatitis A. Hepatitis A is a very old disease. It's not really a big problem anymore. Just know that there's a vaccine for it. I want to talk to you about hepatitis C and HIV and hepatitis B. Okay? So you've already done my work for me. Hep C, they're viruses. You know that they get passed sexually and through needles. In general, we say hepatitis C is not passed sexually, which is untrue for the gay community. It is passed sexually. Okay? And it's the usual case is because HIV is in everyone's minds, and people serosort. 2 guys, HIV positive, they no longer use protected sex because they both have HIV. What they don't know is that one of them could have Hep B or Hep C. And it's the unprotected sex in that setting that can cause transmission. Having said that, even through sex with 2 HIV positive guys, it's not easy. It takes effort to pass Hep C. And generally it means having the kind of sex where either drugs are involved or there's bleeding involved. So use of toys, something that causes bleeding. We think that that's mainly the risk. Okay? And there's really no preventative measure for hepatitis C. It really is knowing how you get infected and avoiding those circumstances. So it's really harm reduction. Very important statement that you made that hepatitis C, HIV is a wimpy virus. It doesn't live outside. But hepatitis C can live on dried surfaces for a long time, which is why the harm reduction models that you can come up with for HIV really don't work for Hep C. Okay, so if you look at the injection sites in BC, they've reduced transmission of HIV, but not Hep C. Okay, it's just because Hep C is more hardy. Okay, so let me tell you about Hep C, and I always take a global perspective because Toronto is global. Toronto is not Canada. Hep C in Canada is different from Toronto because Toronto is this, right? Technically, if you look at how common hepatitis C is in Canada compared to the rest of the world, we're low. We're actually very low, okay? But people come from these areas. The biggest country with Hep C is actually Egypt, and after that it's Vietnam. Vietnam, sorry, here. Okay? So they have a lot of hepatitis C. And the only way you can get so much hepatitis C in the country is if someone deliberately spreads it. Okay, and who does that? It's obviously doctors. So in Egypt, they were trying to get rid of something called schistosomiasis, and they were inoculating everybody, but they were using the same needles, syringes. So a lot of the population has hepatitis C. Same thing is happening in Vietnam. It's because they are not a rich country. They tended to reuse stuff. So Vietnam has a ton of hep C. Okay? All right. So how big of a problem is hepatitis C in Ontario? So let me remind you that Toronto is not the rest of Ontario. We are a very specialized group. But even within the province of Ontario, they actually asked the question, of all the infections in Ontario, which infection causes the most misery in terms of death? Which infection kills you at an earlier age? And which infection causes misery such that you might be disabled? Okay, so blue is premature death. So hepatitis C is the biggest killer in Ontario. Okay, and for perspective, HIV/AIDS is out here. Okay, and that's because it's a false thing because HIV/AIDS you can treat very well. In terms of making people miserable, hepatitis C still outstrips HIV. It's probably because there's 10 times as much people with Hep C than there are people with HIV. Okay, within the province of Ontario, once again, this is public health units and this is GTA. And even then, GTA is not the hot spot for hepatitis C. It's actually up north. This is artificial. This is Kingston because that's where our jails are. Take the jails, the prevalence goes down. I'm from up north, and my pet theory is that people in the north are friendlier and they trust people more than down south. Right? So you share your needles, you share your syringes. People do drugs with friends, and that's why Hep C is so common in the north. Okay, so forget this. I'm not going to talk about this. I just wanted to remind people that hepatitis C is not just a liver disease. It can also cause something vasculitis. So remember, the disease in the liver is when your immune system attacks your liver and causes damage. But your immune system can actually go crazy and haywire and start attacking everything. So it can cause this, which is immune damage to the very small blood vessels of the leg. So people think they have a poor circulation. I'm sure you've heard that before, right? But sometimes it's not a poor circulation, it's actually hepatitis C. And when it can get bad, it can cause big ulcers that are very painful. It can also damage the kidneys. This is when your immune system is damaging your kidney. It's a big long name, MPGN, which stands for membranoproliferative glomerulonephritis. So this is just to tell you it's not very common, but on occasion, hepatitis C damages everything else except the liver. And so you still have to treat Hep C even if the liver is fine. Okay, so I told you that it has no symptoms, so you should go looking for it, okay? There are several tests. The one that everyone knows about is this thing, the antibody test, okay? The antibody test means that antibodies are your immune system. It means your immune system is reacting to the virus, which I said happens to everyone, right? So if you have that, then there's a good chance you have hepatitis C. But it is a screening test. So every screening test must be confirmed. Just because you're antibody positive does not necessarily mean you have hepatitis C. Okay, because remember, some people with Hep C get rid of it. So if you got rid of hepatitis C, your antibody test is still positive. And more recently, now that we have lots of treatments for hepatitis C, if I treat your hepatitis C and I cure you, your antibody test will still become positive. Okay? So once an antibody test is positive, your screen test is positive, it becomes a useless test. It doesn't tell you if you still have it or if you don't. Or worse still, if you got rid of it, it doesn't tell you if you got the infection back. Okay? Even though it's an immune response, it doesn't protect you. It's not a vaccine. So how do you confirm it? You do it by PCR. Effectively, it's asking for a viral load. So if the viral load's positive, you got the virus. If the viral load's negative, you don't have the virus. Okay? And if you get rid of the virus, once again, you're not immune, so for the drug users, if they go back to using, they can get it again. All right. How far have we come with hepatitis C? Hepatitis C was first described in 1989, and we started treating it with drugs that we had on the shelf. You know, they were made for something else, and we said we think it should work against this, and we started using it. So throughout all this time in the 90s and the 2000s, we were using a drug called interferon. Interferon is really like a space age word, right? So what they observed in the lab was that if you have these cells and I throw a virus at it, the virus infects it. If I have these other cells and I throw another virus, virus B at it, it gets infected. But if I have the cells and I infect it with the first virus, then I throw my second virus at it, the second virus does not infect. So what they said is that when you infect your cells make something that interferes with the next virus's ability to infect. And they called this interferon. So you can tell they discovered this in the 1950s, because it sounds very sci-fi, right? So that's what interferon was. It's a very, very old drug. So when they used it, they were trying to cure some people with hepatitis C. Not a lot, but some. And then they've had another drug that they had on the shelf that was used to treat a lung infection called respiratory syncytial virus. It's a virus infection of kids. And when they threw that at hep C, that also cured some people. Okay? They have no idea how they work, they just work. The problem is you have to treat people for a year. And it causes a lot of side effects. And the older you are, the worse the side effects. So what typically is, it messes with your head. It takes your worst personalities and makes them really bad. So if you have a temper, you have a very bad temper. If you're prone to depression, you get very depressed. Okay? So when you use this for a year, it's not infrequently that we have people who are married or have partners, they get into big fights. They may not be able to work because the worst is I've had people who do customer relations, they yell at their clients. So it's not a good recipe. So it plays with your head. But it also remember, this is a substance that your body normally makes to infections. So just think, if you have a cold virus that comes and lands in your nose and your throat, you get a runny nose, sore throat. But then you go and make interferon yourself, you get that fever, the muscle aches, the joint aches. When you give people this drug, that's exactly how they feel. But your cold goes away in a week. This goes on for a year. Okay, just imagine if your flu did not go away for a year. You'd be miserable, you couldn't sleep, you couldn't concentrate. So for example, it would be a disaster to treat a student. You know, I tell them that the Americans found this out. If they treated students, they were very likely to fail their exams. No surprise, right? You can't concentrate. All right. And the ribavirin sort of made things worse. It made you more tired, made you anemic. So for a year, and they were getting cure rates of 20, 40, 50%. And that's what we were stuck with throughout the 2000s. So a lot of people said, do I really want this for a 50% cure? And in the early 2000s, for the people with HIV, the answer is yes. And the reason is because of what you said. With HIV under control since 1997, people started dying of liver disease. Hepatitis C was the biggest risk factor. So we started treating all sorts of co-infects with these drugs. The cure rates for people without HIV are these. With HIV, cut it in half. So we're getting cure rates of about 25% for a year of suffering. So pretty miserable. Okay? So the word got out. Desperate people got treated. The non-desperate people said, I'm never seeing you again. I don't want this. Okay? So that went on for, I just told you about all the difficulties of it, and nobody liked these drugs. So people started looking at it from the HIV angle. You know, with HIV therapies, you have nukes, non-nukes, protease inhibitors, and you all got that because they did research on the virus and knew how it grew. So in 2002, it was a huge breakthrough. They could grow hepatitis C in a test tube. Okay, and then they knew about its proteins. It also has proteases that you can inhibit. It has things that you can throw nukes and non-nukes on. So if you have it in a test tube, you can start throwing all these chemicals into the test tube instead of into people. And that's exactly what happened in 2011 to 2013. 2 new drugs came out, And everyone was so excited about these drugs. Boceprevir and telaprevir, they were the first protease inhibitors for hepatitis C. Okay? So they were very, very excited, and they said everyone should be treated. So in 2011, because in the people without HIV, you were getting cure rates of 75, 80%. Okay? There's a problem though. You still need to be treated for about a year, and it ramped up the side effects like you would not believe. And this is not 100%. This is, 70%. And once again, if you're HIV, you sort of cut that almost by half. Okay, I also promised to tell you about Asian data, and I haven't been doing that. I've just been telling you about European Western data. The Asians are different. We now know that these drugs, the interferons, work better in Asians. Okay? So in people without HIV, over here without HIV, the West was getting cures of 40 to 50%. The Asians, 90%. Okay? And it's completely genetic. There's something called IL-28B, and the Asians all have the perfect genotype. Okay? It's so good, I can tell you that in Asia, they would love to have this medication. Okay? The problem is that it's too expensive for Asia. A year of treatment with interferon ribavirin costs about $24,000. Too expensive for the Asians. If you add boceprevir or telaprevir, the first generation protease inhibitors, your treatment goes up to like $70,000 or $80,000. Okay? So at the last World AIDS meeting, which was in Kuala Lumpur in Malaysia, the Thais got up and said, there's no way. Why would we want to add this drug when we're already at 90%? 24,000 versus 80,000? Who needs it, right? And also the side effects are a lot worse. Okay. So in the West, a lot of enthusiasm. In Asia, no uptake whatsoever. Okay? Now to make things worse, I just described a therapy that's really awful. It does not guarantee a cure. So obviously, if your liver disease is very mild, you're going to say, you know what? Let's wait for something better to come along. But if your liver disease is bad, let's say you already have cirrhosis, you're kind of desperate, right? In the old days, the cure rates were so low, you have this brand new drug that everyone's enthusiastic about, you're going to go for it. The problem is that if you have cirrhosis, these drugs are potentially deadly. They're very, very bad. Okay, they can cause a lot of side effects. So the French were very happy. They actually got access to the drugs first, and they used it on everyone who needed it the most. They had cirrhosis, and the problem is that SAE stands for serious adverse events. So that's anything that, while on treatment, you get a complication. That means you have to go to hospital overnight. And look at that, almost half the people, a third to a half of the people on these drugs ended up in hospital. Okay, and some people actually died from the treatment itself. They would not have died if they left untreated. They died from the treatment. Okay? And some people went into liver failure, that's what compensation means, severe infections, like all sorts of bad things were happening. Okay? So here in Canada, we actually got access to these drugs in 2012. Our clinic used it from January 2012 to June 2012, and then we stopped. We said this is too tough. It's much more toxic than we have ever had. We also knew that newer drugs were coming, so we actually said stop and quit. Ironically, our co-infection people never had access to these meds because the government was taking a long time to approve them for people with HIV. Okay? And so we never got access to these drugs until 2013, early part. And by that time, we already learned from the people without HIV that these drugs were so bad, we actually did not treat our co-infection cohort. We said, you know what, it's already 2013, in 2014 there will be better drugs. I think only one of my people with co-infection went on it because he was desperate, that's it.
And what was the result?
On his treatment?
Yeah.
He went for 3/4 of a year, and then it became clear that it was going to fail. Okay? Because you monitor a viral load on treatment, and it has to stay negative, but at the 9th month, you can see the virus coming back. So it was clear it was going to fail. So it was no point in going for the full treatment for 1 year. Okay, so for us, these drugs were very suboptimal. They're 75% without HIV, With HIV, it drops to 40–50%, and when you add cirrhosis into it, it drops down to about 20%. So his chances were very, very bad. Okay? So the other thing is the cost. Okay? So when the drug companies came out with these drugs, they said, yes, they're expensive, but they're cost effective because it cures more people. What they didn't factor in was how sick they made people, how much it cost when they went to hospital for care because of the drug side effects. They also never counted, for example, some people might be working, but on these drugs they cannot work. Okay? So in New York City, they looked at all the patients that were treated, and they calculated the cost to achieve one cure, and it came out to be $195,000 if you did not have cirrhosis, and $250,000, these are US dollars, for anyone with cirrhosis. Very expensive. There's no way this is cost effective. Okay? So when I presented this in Malaysia, I said you could cure one person, or you could house a family of 4 in this house in Richmond Hill for 10 years. Hep C treatment is different from HIV. HIV is forever because you can't cure. The goal of Hep C treatment is to cure the infection. So once you're finished, you're done. Were we wrong in denying people treatment in 2013? I don't think so, because in January 2014, 2 new drugs have come onto the market. Okay? And the other thing I tell people is that we've always been jealous of the Americans, because the Americans always get drugs before Canadians, right? Even for HIV drugs, they got it, we have to wait for 12 months. Well, be careful what you wish for, because we are now like the Americans. We got this drug before the Americans by 1 week, and they got this drug 1 week before us, but it's about the same time. So we're now considered a tier 1 country. So we get it before Europe, we got it before Australia, before anyone else. The problem is, we have the American problem. These are ridiculously expensive. So in the US, this drug is $1,000 a pill.
One pill.
One pill. So fortunately, Canada being Canada, we're actually a bit better than the US because our governments negotiate a different price. So in Canada, this is only $650 a pill. If you use this and this, which some of my patients are doing, it's $100,000. And the way things are, obviously, is if you pay cash, it's cheaper. Why? Okay, so why is it so expensive and what's different? So first of all, when you use this and this, there's no interferon, there's no more needles. It's not a year of treatment, it's 12 weeks. These days, if I treat 100 people with the old drugs, I might cure 60 people. With this, I cure everyone. 12 weeks. Almost guaranteed it will be gone. The major reason why it doesn't work is, in some people, they don't take their medications.
No.
This doesn't make your body fight the virus. This destroys the virus directly. This is like HIV therapy. It doesn't matter where you come from. It just works, and there's close to no side effects. The Canada ODSP drug card will not cover this. Not yet. It's too new. It was only just released. Health Canada approved it in January. ODSP has to wait for a federal agency to review it, and they're not going to do it until August or September.
Not even Trillium.
No. You have to go to the federal first. Trillium is provincial. Provincial will see it probably in September. Okay? And I can tell you that there's no way they're going to pay for it if you have minimal disease. It's too expensive. Okay? So the people that I'm treating right now, believe it or not, I have people who are paying cash for this. And if they have a private drug plan, their private drug plan will pay for this. But that's it. What I'm telling you now will be obsolete in 6 months because there are other drugs coming. So it's not, what I just showed you, this is a new polymerase inhibitor. This is a new generation protease inhibitor. Oh yeah, the other reason why this is better than the old drugs was ridiculous. It was ridiculous. These 2 pills, the protease inhibitors, 4 pills every 8 hours. Not 3 times a day, every 8 hours. Midnight, 8 a.m., 4 p.m. Okay? These drugs are also so difficult. If you put it in a glass of water and leave it overnight, it will not dissolve. So you cannot just take it. It only dissolves in fat. So for these pills, you have to eat 20 grams of fat each time you take the pill, every 8 hours. So 20 grams of fat is 1 KFC drumstick and a thigh. That's what you tell patients. It's 2/3 of a Big Mac.
Can you drink with oil?
You can drink it with oil. Some people do that. But that's how every 8 hours. Okay, it's terrible, and the side effects. I wouldn't even go. The side effects are bad. This is 1 pill a day. It doesn't matter. Okay, that's why they're charging so much for it. Drugs, the side effects are so bad. Aside from forcing yourself to eat this stuff, you're not going to eat very much else. It's miserable, okay? So everything I just told you is for people without HIV. The studies in HIV are being done right now. It looks like it works just as well for people with HIV as without HIV. So we're hitting an era, if you have co-infection, we can actually cure your Hepatitis C pretty easily. The problem is going to be cost, and also working out how these drugs might interact with your HIV drugs. Okay, so that's being worked on right now. Okay, but having said that, this in the next 6 months will become obsolete because there's newer drugs coming. Okay, like you know with HIV in 1997 it was terrible. It's the same story. You had pills that you had to take frequently. People used to set their watches for the AZT. They got kidney stones. It was terrible side effects. And then you got better with side effects, and then you're now into these single pill regimens. That's where Hepatitis C will be 1 year from now. We will have single pill regimens. There will be not just 1 or 2 drug companies, and we'll have 3 or 4 drug companies in, and we're hoping maybe the prices will go down a bit. Okay? But that's all coming. The studies in the old days, people with HIV, they never used to study. But nowadays, we're actually doing the studies on people with co-infection already, so they're working out the drug interactions. All of our patients in clinic are not being treated with the stuff that's available on the market. They're all waiting for studies, because the studies don't give you this, they give you the next generation. Okay? And the pace of development is much quicker than HIV. When you think about HIV drugs, they always have to treat someone for a year or 2 and look at the difference between the old drugs. Here, all the new drugs, excuse me, cure you in 8 weeks or 12 weeks. Right? So they only have to, their studies are so short and they know the answer already. So that's why I tell people, like right now, the next major meeting is in April, early April. Okay? So there's a good chance that everything I just told you is obsolete. Okay? And by November is the next meeting, all this is for sure obsolete. Okay? So it's very exciting. Hep C will be curable. The question is, how desperate are you for a cure right now? 99% of the patients I see right now are waiting for the new stuff. Is there a risk to waiting? So, at the very beginning I told you that Hepatitis C damages your liver, but it takes a long time, over 10, 20, 30, 40 years. So in general, even if you have cirrhosis, a 1-year wait is not very long. Okay, so we're not telling people to wait many, many years, maybe 1 or 2 years, because it's a matter of the drugs coming onto the market and figuring out how to use it with other medications like HIV medicines. So part of my problem is, not that long ago, HIV folks were doing drug holidays, right? And then they figured out drug holidays was not a good idea, which is too bad, because it would make this treatment so much easier if I just put everyone on an HIV drug holiday and just treat it and then put them back. But the HIV docs won't let me do that, right? But the argument is, if you're desperate enough, right? Let's say you've got co-infection, your HIV is not bad, but your liver is falling apart, then the obvious answer is go on a drug holiday for your HIV, get rid of your Hep C, and then go back. It's only 12 weeks, and then go back on your HIV therapy. That's the kind of thing I think we will do until we figure out all the drug interactions. The donation is, your liver is a remarkable organ, because the reason why it takes so many years to damage your liver is your liver is one of the few organs, it's the only organ that can grow back. Okay? So if you have a normal liver, and I chop off 2/3 of it, 1/3 is enough to keep you going. Okay? So the nice thing is, if you take care of yourself, eat properly, within 8 weeks the entire thing grows back. Okay? So, in people who are dying of liver disease and they need a liver transplant, one of the most common way that they survive and get a transplant is not getting a whole liver, they only get part of a liver. So their friend or their family donates their liver, right? They retain 1/3 of the liver, it grows back in 8 weeks, but that 2/3 is enough to keep that their friend or family.
So will that cure the cirrhosis?
Yeah, well, if you have to give a normal liver that doesn't have cirrhosis, right? So what you do is you take out the cirrhotic liver and you give them this normal liver. Is a cirrhotic liver, will it regenerate itself? The answer is it depends, okay? So if you are damaging your liver very quickly and you just became cirrhotic and it's only been a year or 2 or 3, and then I take away whatever was damaging your liver, say it's either Hep C or Hep B, that liver will regenerate. Within a couple of years there will be no more cirrhosis. But if you've had Hep C for 35 years and you've already had cirrhosis for 15 years, right? It's almost like you've passed the point of no return. Even if you got rid of Hep C, you still have cirrhosis. So it depends on how long you've had it for. Cost of a liver transplant. In Canada, the operation itself is $100,000, but then there's the medications to maintain it afterwards. Because when you have someone else's liver, your body knows it's not yours. So your immune system will try and get rid of it. So you have to take drugs to prevent your immune system from getting rid of it. C, should I just get a liver transplant? The answer is no. Okay, remember how you get Hep C is if you get a contaminated needle with a drop of blood, right? And the virus will find its way to your liver. If I took someone with Hepatitis C, their entire body is full of virus, right? I put in a new liver, guess what? The first 1 second, your new liver has Hepatitis C, okay? So the only reason for getting a transplant, because it's such an extreme thing to do, is if you say to yourself, my chances of living a good life with a transplant is better than my chances without a transplant, okay? In those stages of cirrhosis, remember I told you to show you the bleeding veins and all that stuff? At that point, your chances of living a good life without a transplant are better than with a transplant. So they would say no transplant. But once you have the water, the ascites, which is the next stage, then you can say my chances of living with a transplant are better than without a transplant. That's when you get a transplant. So, liver cancer, we can cure liver cancer without a transplant. Okay? So if someone has liver cancer that I can cure without a transplant, why would I give them a transplant? Because after a transplant, they have to take all these terrible drugs that can cause high blood pressure, high risk for lymphoma, weight gain, all that stuff, right? If I see a cancer that's under 2.5 centimeters, 1 inch, right? Because I've been looking for it, it's like Star Wars now. They can, by computers, know exactly, you're standing there, they know exactly where the cancer is. They stick a needle right into the middle of the cancer, they flick a switch for 2 minutes, it's like a microwave, you burn it. Cures cancer, you go home the same day. Why would I need transplant? Okay? But if the cancer is big, that no longer works. And the only way of curing your cancer is if you get a transplant, then you get a transplant. Right? You always ask, is there anything better than a transplant? Because transplant is expensive and it has trouble. Why would I want to do it until I absolutely have to?
So transplant was the last option.
Transplant is your last option. People feel like when you have liver failure, you feel miserable, really, really miserable. And when you get a transplant, you wake up and you say, oh my God, I feel so good. But you've forgotten what it feels to be normal. Because if you're normal, you feel a lot better than someone with a transplant. If you have HIV, you have to ask the question, are they at risk for getting hepatitis B and hepatitis C? So it depends on your patient population. Are they doing things that put them at risk for infection? Are they partiers? Do they share drugs? Are they having unprotected sex? Are they at risk of getting infection? Because if the answer is yes, your doctor should be checking you for hepatitis B and hepatitis C every year. Okay? Take it another way. Let's say you don't have HIV. Let's just say you moved here from Winnipeg, you're 21 years old, you've discovered the big city, and you have nothing, right? But you're playing around with everybody. You're going to get checked for HIV every year, right? Just because you have HIV doesn't protect you from getting either hepatitis B or hepatitis C. Your doctor should be checking you for both viruses every year. And they should be taking proactive steps, saying, okay, you don't have hepatitis B, but you're playing around. You should get the vaccine to prevent hepatitis B. Right? The problem is that there's no vaccine for hepatitis C, so you have to check every year.
The Twinrix.
Twinrix is a vaccine for hepatitis A and hepatitis B, not C. It's very good.
Yeah.
It's very good at protection. But HIV, is the vaccine forever? Probably not. Have I ever seen people who got the vaccine and then get hepatitis B? The answer is yes. So it's one of those things where nobody really talks about. But if you're at risk personally, actually, I'm one of these people. I know that I don't respond to the Hep B vaccine very well. And so every year I check my Hep B titers. Because in my line of work, I see 2,000 hepatitis B patients a year. And I do things to them. I do procedures on them, and I know they have a lot of virus. So if my antibody titers fall, I get vaccinated. Because I'm at risk. But then take another scenario. Let's say I have a 80-year-old Italian grandmother who got her hepatitis C from Italy, because it's also very common in Italy back in the 50s, right? How is she going to get hepatitis B? She's not. So why would I vaccinate her? Why would I even care? Okay, unless you tell me she's one of these women that goes off to Florida, that's the other phenomenon, right? And that's where the next big epidemic is happening, is because all these women plus a few guys and they're spreading HIV. So those people you want to vaccinate. So you have to talk to your clients or your patients and figure out what the risk profile is and say, will they benefit from this intervention? So the vaccination for hepatitis B is available for anyone with a chronic liver disease like hepatitis C and for anyone with HIV. It's available free of charge from public health. The problem is they will give you the hepatitis B vaccine separately, whereas there's this thing called Twinrex, and Twinrex is actually a better vaccine. It's more likely to work, and it's less shots. When you have HIV, they do routine blood tests on you.
Right.
Okay, so they always check your kidney test, because one of the most popular HIV test medicines, Viriad, can cause kidney trouble. So every time they check your kidneys. Then, if your doctor is not a liver doctor, they'll say your liver function tests are normal. A liver function test for them is not a liver function test to me. Remember I told you liver function is to make things, and liver failure is when you're no longer functioning, you're losing muscle and all that stuff. To me, that's liver function. What they mean is the ALT, AST, which are the enzymes that are released when there is a hepatitis going on. Okay? So the problem is that the doctors who are not trained in liver, as long as the numbers look okay, you know, normal or abnormal but not too bad. Abnormal but no different from before, they'll say it's okay. But for me, I'll say it's abnormal. Abnormal is abnormal. Okay? So for me, if it's abnormal, I have to check for hepatitis B and hepatitis C. But for a lot of doctors who are not trained in liver, they'll just say, oh, it's the same, you've always had this, why do I care? They forget that when you have hepatitis B, if you got it as a baby, you'll have it your entire life. So that's why it looks the same. But that doesn't mean that you don't have a lot of damage to your liver. The nice thing about the Viriad, so it's bad for your kidneys, but it's not truly, Viriad, I tell people, is like aspirin. Even aspirin can damage your kidneys, but it's very, very rare. The nice thing about Viriad is that it also very effectively controls Hep B. So if you have Hep B and HIV co-infection, it's actually a very good drug. Okay? The danger is the other way around. So let's say you have HIV for a long, long time, and you also have Hep B, but everyone forgot about it. You're on Viriad, and let's say you're one of these unfortunate people after 8, 9 years, your kidney function is not as good. It's slowly getting worse. They're going to blame the Viriad, right? So they're going to switch you to something new, something fancy that does not have Viriad in it. The problem is not only are you taking off Viriad for your HIV, you're also taking off Viriad for your hepatitis B. So in some people, when they make that switch to make your kidneys better, your liver goes bad because you're suddenly no longer treating your Hep B. Okay, so that's where Hep B co-infection becomes important, because the standard now is anyone with HIV gets checked for Hep B, and if you have Hep B, you're on Viriad. The problem is that if you don't think about it, you will forget, and the danger is actually not going on Viriad, but going off Viriad. We're going to have all this stuff. We're going to have nukes, we're going to have non-nukes, we're going to have something called replication complex inhibitors. We're going to be, so this was 2011, this is like HIV in 1997, right? Multiple drugs, second timer, all this stuff. 2014 is like HIV in the mid-2000s. End of this year will be like HIV in 2015. We'll have single pill regimens, no toxicity, cure rates of 100%. Happening so fast. I love this slide because this is a paper in a very prestigious journal published in 2013, but they're already obsolete because they didn't think all of the stuff I just told you, they thought it was going to happen in 2018. It's false. It's going to happen within a year. So something published last year is obsolete. Okay, and they also thought the cure rates were going to be around 90%. It's actually closer to 100%. With the new drugs, like I said, the major cause of treatment failure are patients who don't take their pills. Adherence. So why do HIV drugs have side effects versus Hep C drugs have no side effects? So in one way, we said that HIV is wimpy just because it cannot survive on dry surfaces, but inside the body, HIV is very robust. Okay, you need a lot of drugs, and you need higher doses of drugs. Outside of the body, Hep C can survive a long time. True, but within the body, it's very sensitive to these drugs. Okay, so whenever you have drugs that you don't need to use very high doses of, your side effects are less. Okay, and when you don't need very high doses, you don't need to take it multiple times a day. You don't need giant course pills, right? And it's just easier. And it's just lucky for us that within the body, the Hep C is wimpy. Hep B. Okay, dark colors is where Hep B is common. Light colors, nothing. So Canada technically has no Hep B. Okay, but once again, we're not Canada, we're Toronto. Look at here, all dark, right? And in China, it's terrible. So about 20% of people have chronic hepatitis B. So when I say this map, it's chronic lifelong infections. That's it. So they estimate about 400 million people in the world have chronic lifelong infection with hepatitis B. That's different from saying how many people have ever been infected with hepatitis B. As I told you, 90% of people will get infected and get rid of it. So that figure is over 3 billion. Okay? So, an amazing studies out of China, it's actually out of Taiwan. They first figured out Hep B caused liver disease in the 80s, and they came up with a vaccine. The way they figured out, remember I told you with Hep C, the French guy did biopsies and said how long you had infection? Well, in Taiwan, they did something more clever. They actually checked all the people with hepatitis B at different ages. So, people who were born and got Hep B within the first couple of years of life, their mothers had Hep B. So 2%, 10%, 20%. Right? And when you check them at age 5, nobody really got Hep B. Age 10, nobody. Age 15, nobody. But at age 20, suddenly you went from 20% to 90%. That's because everyone was having sex. Okay, then they said, oh, it's from the mother and it's from sex. Okay, so back in the 80s, if you ask what proportion of Taiwanese or Chinese people had Hep B, the answer is 90%, 90, of which 20% could not clear the infection and have lifelong infection. Okay? And when it's so common, you can just imagine it will just pass on from generation to generation. And you know the Chinese people, they are very communal, they look after each other's kids, right? Infect the kids, and the kids, they play together, they bite and scratch each other, they infect each other's kids. So it just goes on, and that's why it's so common. But once it's common, it's common. We're just lucky that in North America it's not so common. I actually have been here to Mongolia, and I've seen the reindeer people. They look like they live in teepees. They look like our native people.
Yeah, that's it.
But this way. This way becomes here. They have the same kind of Hep B. It's the same. But like I said, if I went here and they look the same. They actually look like our natives. They have teepees. They have. Whereas hepatitis B? Hepatitis B is under hepatitis C because it's mainly a Toronto problem. So whereas hepatitis C, there's hepatitis C everywhere, not so common. But hepatitis B is very uncommon in Canada, except for the areas of immigration. So GTA, Toronto, Vancouver, that's where hepatitis B is. And even despite that, because of Toronto, we're actually more of a problem than HIV/AIDS. Okay, just by the sheer number of patients. Okay, you already went through this and where it's in fluids. The testing is complicated. Just so you know, it's a lovely virus, and if you're into the science of it, it's actually very, very interesting. But just be, I have to tell you, it's a very smart virus. Okay, so these are the virus particles. Okay, and your immune system can recognize it. The vaccine can recognize this orange viral particle. But the virus, for every one of this that it makes 100,000 of this. This is not a virus. This is just a particle with no virus in it. Okay? So when your immune system is trying to get rid of this, it's more likely to see this. So your immune system will get rid of this, which is not the virus, and leave the virus alone. That's how it is. It hides from your immune system. Like a needle in a haystack is the expression. Very smart virus. Okay? In terms of testing, we tell people in the communities to always do 3 tests. Something called the surface antigen, antibody, and core. And from those 3 tests, you pretty much know everything. Okay? If the surface antigen is positive, the surface antigen is this thing. It's this thing. The surface antigen is on the surface of this. In HIV, they would call it envelope, but in hepatitis B, they call it the surface. Okay? And the reason why it's such a good test is because it detects both this and this. So because for every virus there's 100,000 of these, surface antigen is always positive when you have hepatitis B. Okay? And if you don't have hepatitis B, you make the antibodies, so when you vaccinate, you get the antibodies. But there's also a little thing called core. Core is also an amazing thing. Core is inside the center or the core of the virus. Okay? So here's the important thing. If you have the antigen, it's from the virus, you're infected. Done. Okay? If you don't have the antigen, you have to ask, do you have either the surface antibody or the core? If your core is positive, it means that at some point in your life you were already infected. And that's important to know, because if you're already infected, there's no point in getting the vaccine. You can only be infected once, unlike Hep C, where you can be infected over and over and over again. Okay? And it's important to say, because the vaccine for me is painful. Right? The vaccine, you have to vaccinate today, come back 1 month later for a vaccine, and come back 6 months later for a vaccine. So it's 3 shots. And sometimes it's very hard to get people to come back over and over again for the vaccine. So if you already know this, then you don't need to vaccinate them. So, for example, in our injection drug user population, they're at risk for HIV, Hep B, Hep C. 80 to 90% of them will be core positive because Hep B is so infectious. You said Hep C is 10 times more infectious than HIV. Well, Hep B is 10 times more infectious than Hep C. Okay? So, if they're a core positive, I don't need to vaccinate them. And if they're surface antigen negative, they've gotten rid of the infection. But if all the markers are negative, surface antigen negative, core is negative, surface antibody is negative, this person is at risk for infection if they get exposed. So if they're high-risk behaviors, this is the person you need to vaccinate.
Okay.
Chinese people are paranoid and scared about sharing food. They share food, but they're afraid, right? So nowhere here did I say that you can get hepatitis from food. The only way you can get hepatitis from food is if you bleed into your food.
How?
The fancy Chinese restaurants now, they give you a serving chopstick.
Okay.
You don't need it. You can actually just use your chopstick and reach it. Then for the non-Chinese people, you can double dip. Not a problem. You didn't ask is, what about sex? Heterosexual, monogamous sex. Can you pass this on? The answer is very, very rarely. So hepatitis C, almost never. Okay? Almost never.
Except blood, that's it.
It's blood. So unless you do the kind of sex that causes bleeding. But they looked at couples that have been married for 25 years, only like 1 couple out of 25 will pass hepatitis C. So it's that after 25 years of sex. Very, very unusual. Whereas hepatitis B, much more infectious. Hepatitis B is a sexually transmissible infection, much more infectious than anything else. Okay? And the reason why is because if you check the viral load, you know HIV viral load might be 10,000, 100,000. Hep B viral load is 1 billion, 1 trillion. Okay? So each drop of blood has a lot more virus, which is why it's so much more infectious. That we use to treat Hep B also are active against HIV. Almost every Hep B drug is active against HIV. Sorry, I almost said hepatitis I.
That's a new one.
Okay, so we use 3TC, we use tenofovir. I don't know if you know, but son of tenofovir is coming. So tenofovir is TDF and son of tenofovir is called TAF. You haven't heard of it? Tenofavir's patent is expiring, so you have son of tenofovir. Be aware that for the Asian community, by far it's hepatitis B, because the disease is from your home country. Okay? And it's also passed within families. So we know how to break that cycle now, right? So any woman who's pregnant in Canada automatically gets tested for HIV and Hep B. If they're Hep B positive, the baby gets a vaccine at birth, and that prevents the infection, so they no longer get lifelong infection. Okay, so Hep B will disappear in 30, 40 years. Okay, because of vaccine. It's the only one that has a vaccine. C, D, and E, and F, and G.
So is E, F?
E is from animal infected livers that's not properly cooked. Pigs. Pig liver. So if you ever go to a market and you look at liver, it has to be smooth and soft. But if you ever see like a little red circle the size of a quarter, hepatitis E. Don't buy it. E is different. It is relatively common in India. Okay, but in North America, it's associated with pigs. Okay, and they've shown, like, for example, some of the Japanese have actually gotten hepatitis E from restaurants. If you go to France, the south of France, about 20% of the sausage you buy in the markets has Hep E in it. Hepatitis E is more common than you think. If you check everybody in around this area, looking for antibodies, about a third of people have been infected in the past with Hep E and never knew it. For testing, where you can go for testing for Hep C, your HIV doctor, when you first come with HIV, first assessment, should be testing you for Hep B and Hep C. Anyone with HIV, you're supposed to get Hep B and Hep C testing. Okay? If you don't have HIV, then your family doctor should have known that anyone who is Asian should be tested for Hep B, because Hep B is so common in the Asian population. Okay? It should be an automatic knee-jerk test. Yeah. Once someone is diagnosed with HIV, they should automatically, the guidelines say so, test for hepatitis B and hepatitis C. If you don't have hepatitis B and are not immune, you're supposed to get vaccinated. And if they determine that your risk behavior is high, then you're supposed to get testing every year to see if you got it. If you didn't have it this year, you could have it next year. Okay, so you should know, for example, doctors who operate on people, they can be exposed to all this viruses, so by definition, they are at risk. So those doctors have to get tested every year. Right, so it's the same thing. Anyone who's at risk gets tested every year.
Any other questions for Dr. Wong?
Risk actually in the public is in nursing homes. Okay? In nursing homes, just imagine your grandmother has diabetes and she checks her blood sugar with that machine, right? Let's say she loses her machine. What is she going to do? She's going to borrow her neighbor's. The problem is if her neighbor has hepatitis, guess what's going to happen to her? That's